Welcome to Studio U. You are here with Sonya Reynolds, head nutritionist, and myself, owner of Studio U. Today we wanted to discuss with you some non-invasive methods for assessing your gut health. We do this all the time in clinic. We use a lot of functional medicine in our clinical practice, and one of the reasons for that is that we want to get the real data. We want to get the information so that we can base our clinical protocols on that rather than just guessing.
Yeah, we're looking for the cause.
Yes.
We're looking for the cause, and then we're going to base our treatment around that for sure.
So Sonya, you do a lot of gut testing. What test would you recommend or do the most, do you think?
IgG, so food intolerance testing, which is a skin finger prick test. I use a lot in clinic to help target whether certain foods are an issue for someone. But also, 101 elimination diets is something that we would use as part of that as well to look at certain foods. Also, we do different microbiome testing. So what that means is we look at stools as well. We don't look at the stools.
We don't look at stools.
The functional testing houses look at the stools. So we'll send that away, and it can give us really great data around inflammation of the gut, whether certain foods actually influence that inflammation, like gluten. We can also see things like what sort of bacteria you have as well, or parasites.
Yeah, and one of the other things that I love about that gut testing that we do is that it shows us your immune system reactivity on the gut lining, and that can be a key insight into many gut conditions, from anything from constipation to IBS to SIBO to there's so many issues that can be really helpful in knowing.
And one that we forget to mention is x-rays as well. So you refer a lot of people back to the doctor to see if these people are actually eliminating in total.
Yeah, because a lot of people, especially in kids, we treat a lot of pediatrics here at Studio U, they are constipated without realizing it. Up to maybe 10% of people that are constipated actually realize they're constipated, and often this can cause ongoing problems in other areas. So yeah, an x-ray is a very good way to determine if you have any level of fecal impaction or backloading of the colon. So really important and non-invasive. Obviously we don't want to do x-rays every week, but to get the right information, an x-ray can be incredibly helpful.
Especially if someone's got a chronic issue, you want to be really looking for that.